Most people think knee pain after 65 means the knee is simply wearing out. But many painful knees are not failing because of age alone. They are hurting because the body around the knee has quietly changed. My name is Dr. Catherine Blake, and today I want to explain knee pain in a way that feels practical, calm, and useful. Not with fear, not with complicated medical language. Just a clear look at what often happens after 65 and what you can begin to correct first. The hidden truth is this: the knee is often the place where pain shows up, but it is not always the place where the problem starts. Your knee is like the middle hinge on a long door. If the frame above it or below it shifts, the hinge takes the stress. And after 65, several parts of that frame can change at the same time. I remember a patient I will call Margaret. She was 71. She told me, "My knees started hurting, so I stopped walking. Then they got worse, so I stopped even more." At first, she thought she was protecting her knees. But what actually happened was that her thigh muscles became weaker, her hips became stiffer, her balance became less steady, and every step placed more strain directly through the knee joint. She did not have one single dramatic injury. She had a slow loss of support. That is what catches many people off guard. Today, I will show you 8 common reasons knees hurt more after 65, what people usually think is happening, what is actually happening in the body, and the first simple fix to consider. As we go, you will notice one important pattern. The knee needs strength, circulation, alignment, and steady movement. When one of those systems weakens, pain often increases. Let's begin with the first one, because it is often the most important. 1. Weak thigh muscles make the knee do too much work. What people think it is. Many people feel pain in the front of the knee, around the kneecap, or deep inside the joint, and assume, "My knee is worn out." They may think the cartilage is gone, or that the joint is too old to handle normal walking. What it actually is. Very often the first problem is not the joint surface itself. It is weakness in the muscles that support the joint, especially the quadriceps in the front of the thigh and the hamstrings in the back of the thigh. Your knee is not meant to carry your body weight alone. It is meant to work as part of a team. The thigh muscles act like shock absorbers. When they are strong, they help control the knee with every step, every stair, and every time you rise from a chair. After 65, muscle loss becomes more common. This is not laziness. It is a normal body change called age-related muscle loss. If a person has been less active, had an illness, gained weight, avoided stairs, or sat more during the day, those muscles can shrink even faster. What is happening in the body? Every time your foot hits the ground, force travels up through the ankle, knee, hip, and spine. A healthy muscle system absorbs and spreads that force. But when the thigh muscles weaken, the force becomes more concentrated in the knee. Think of your knee like a bridge. The joint is the road surface, but the muscles are the support cables. If the cables become loose, the road surface takes more stress. The bridge may still be standing, but it feels less stable and wears down faster. This is why some people say, "My knee hurts more when I go downstairs." Going downstairs requires the quadriceps to slowly control your body weight. If those muscles are weak, the knee absorbs the drop instead. That can feel sharp, heavy, or unstable. Light scientific support. We know that stronger leg muscles are linked with better function in people with knee osteoarthritis and age-related knee pain. Strength does not remove every joint change, but it often reduces pain because it improves control. A knee with support usually hurts less than a knee doing the work alone. Practical habit or fix. Fix this first by building gentle strength around the knee. Start with the sit-to-stand exercise. Sit in a firm chair. Place your feet flat on the floor. Stand up slowly, then sit down slowly. Use your hands if needed at first. Do 5 repetitions. Rest, then repeat once more. The key is control, not speed. A second option is a straight leg raise. Lie on your back with one knee bent and the other leg straight. Tighten the thigh of the straight leg, lift it a little, hold briefly, and lower it slowly. This teaches the thigh muscle to wake up without grinding the knee. Do not push through sharp pain. Mild muscle effort is acceptable. Joint pain that increases and stays worse is a signal to reduce the amount. This first point matters because weak muscles often begin the whole cycle. But muscle weakness is not the only reason knees become painful after 65. The next one is where many people get caught off guard, because it often starts in the hip, not the knee. 2. Stiff hips can twist the knees. What people think it is. When the knee hurts, most people look only at the knee. They rub the knee, brace the knee, ice the knee, or blame the knee. What it actually is. Sometimes the knee is reacting to poor movement above it. The hip controls the position of the thigh. The thigh controls the angle of the knee. If the hip becomes stiff or weak, the knee may drift inward, twist slightly, or take pressure unevenly. This is especially common after 65 because many people lose hip mobility from years of sitting, reduced walking, or avoiding deeper movements like squatting, bending, or stepping sideways. What is happening in the body? The knee is mostly a hinge joint. It bends and straightens. It does allow a little rotation, but it does not like being twisted repeatedly under load. The hip is a ball and socket joint. It is designed to move in many directions. When the hip stops moving well, the knee tries to borrow movement it was not built to handle. Imagine a door hinge attached to a crooked door frame. The hinge may squeak, but the real issue is the frame. You can oil the hinge all day, but if the frame is still crooked, the hinge keeps getting stressed. This can show up when walking, climbing stairs, getting out of a car, or turning in the kitchen. A person may say, "I just turned slightly and felt my knee grab." That small twist may be the knee absorbing motion that should have come from the hip. Light scientific support. Hip strength, especially in the muscles on the outside of the hip, helps control knee alignment. When those muscles are weak, the knee may collapse inward during walking or stairs. This can increase stress around the kneecap and inner knee. Practical habit or fix. Add a gentle hip habit. Try side steps at a kitchen counter. Stand tall and hold the counter lightly. Step to the right, bring the other foot in, then step again. Do 5 to 10 small steps each way. Keep your toes facing forward. Avoid letting the knees cave inward. Another useful movement is the seated hip opener. Sit tall in a chair. Keep one foot on the floor. Gently move one knee outward a few inches, then bring it back. This is small, but it teaches the hip to rotate without forcing the knee. The goal is not to become flexible like a dancer. The goal is to give the knee a better teammate. And once the hip starts moving better, many people notice the knee feels less trapped. But there is another area below the knee that can quietly increase pain, especially when walking becomes shorter or more careful. 3. Stiff ankles change the way force travels through the knee. What people think it is. Many people think knee pain during walking means the knee joint cannot handle movement anymore. They shorten their steps and try to walk carefully. What it actually is, sometimes the ankle has become stiff, especially the ability to bend the ankle upward as the body moves over the foot. This motion is called dorsiflexion. When it becomes limited, the knee changes its path. The ankle is the first major joint to respond when your foot hits the ground. If it does not move well, the force has to go somewhere else. Often it goes to the knee. What is happening in the body? Walking is like a smooth delivery system. The foot accepts the ground, the ankle bends, the knee follows, the hip extends, and the body moves forward. When one part of the delivery system slows down, the package gets jammed at the next station. A stiff ankle is like a blocked pipe. Pressure builds behind the blockage. The knee becomes the next place that pressure shows up. This is why some people with knee pain also have calf tightness, flat feet, foot pain, or a history of ankle sprains. They may not connect these problems, but the body connects them every time they take a step. When ankle motion is limited, people may turn the foot outward, lean forward, or let the knee collapse inward. Over time, these small changes add up. Light scientific support. Walking mechanics matter. Limited ankle movement can affect knee loading, step length, balance, and the way the kneecap tracks. In older adults, even small changes in foot and ankle function can influence knee comfort and fall risk. Practical habit or fix. Try a simple calf and ankle mobility drill. Stand facing a wall or kitchen counter. Place one foot slightly behind the other. Keep the back heel down. Gently bend the front knee and feel a stretch in the calf of the back leg. Hold for 20 seconds. Switch sides. Then do ankle rocks. Hold the counter. Place one foot forward. Slowly bend the front knee toward the toes while keeping the heel down. Move only in a comfortable range. Repeat 8 to 10 times. Do not bounce. Do not force. Think of it like oiling a stiff gate. Better ankle motion can make walking smoother, and smoother walking usually means less stress at the knee. Now we have looked above the knee and below the knee. But the next factor happens inside the joint itself, and it is one of the most misunderstood changes after 65. 4. Cartilage changes are not the same as a hopeless knee. What people think it is, many people hear the word arthritis or cartilage loss and believe their knee is ruined. They may think pain means bone is grinding on bone every time they move. What it actually is, cartilage changes are common with age, but pain is more complex than cartilage alone. Some people have visible arthritis on an X-ray and only mild pain. Others have severe pain with less dramatic imaging changes. This does not mean the pain is imaginary. It means the knee is a living joint, not just a worn machine part. What is happening in the body? Cartilage is the smooth protective covering at the ends of bones. It helps the joint glide. But cartilage has limited blood supply, so it depends on movement to receive nourishment through the joint fluid. The joint fluid is like oil in an engine, but it does not circulate well when the engine is never started. Gentle movement helps spread that fluid across the joint surface. When people stop moving because of pain, the joint can feel stiffer, drier, and more sensitive. The muscles weaken, the joint gets less nourishment, and the pain system becomes more alert. This creates a cycle. Pain leads to less movement leads to more stiffness, stiffness leads to more pain. Light scientific support. In knee osteoarthritis, regular low-impact exercise is often recommended because it can reduce pain and improve function. Movement does not have to be intense to be helpful. It simply needs to be consistent and appropriate. Practical habit or fix. Use short, frequent movement snacks. Instead of one long walk that leaves the knee aching, try 3 short walks. For example, 5 to 8 minutes after breakfast, lunch, and dinner. Or walk inside the house for 2 minutes every hour. Cycling on a stationary bike can also help some people because it moves the knee with less impact. The seat should be high enough that the knee is not deeply bent at the top of the pedal motion. Warmth may help before movement, especially for stiffness. Ice may help after activity if the knee becomes irritated. The best choice depends on how your knee feels. Stiff and cold often responds to warmth. Swollen and hot often responds better to cooling. This is important. Arthritis does not mean stop moving. It means move wisely. And that leads to the next issue, because many people think rest is always the safest choice. After 65, too much rest can become one of the biggest reasons pain grows. 5. Too much rest makes the knee more sensitive. What people think it is. A common belief is, if my knee hurts, I should rest until it feels better. Rest can help after a flare-up or injury, but long-term rest is different. What it actually is. Too much rest weakens the muscles, stiffens the joint, reduces circulation, and can make the nervous system more sensitive to pain. Pain is not only a message from the joint. It is also processed by nerves. When a body part is painful for a long time, the nerves can become more alert, like a smoke alarm that goes off with burnt toast instead of a real fire. What is happening in the body? Nerves work like electrical wires. They carry signals from the knee to the spinal cord and brain. When the knee is irritated, those wires send warning messages. If the irritation continues and the person becomes fearful of movement, the warning system can become extra sensitive. This is why a knee may hurt even during small activities that are not damaging. The pain is real, but the alarm may be turned up too high. Rest can feel helpful at first because it reduces stress. But if rest continues for days and weeks, the support system weakens. Then normal activity becomes harder. A short walk feels like a big event. Stairs feel threatening. Getting up from a chair becomes a test. It is like leaving a car parked for months to protect it. At first that seems safe, but eventually the battery weakens, the tires lose air, and the engine does not run smoothly. The body is built to be used. Light scientific support. Older adults benefit from regular strength and balance activity. For knee pain and arthritis, guided exercise often improves pain and function. The key is graded movement, not forcing through severe pain. Practical habit or fix, use the calm and continue rule. If activity causes mild discomfort that settles within 24 hours, that level is often acceptable. If pain becomes sharp, swelling increases, or the knee feels worse the next day, reduce the amount. Start below your limit. That matters. For example, if 20 minutes of walking causes pain, start with 6 minutes. If 10 sit-to-stands are too much, start with 3. Build slowly. A simple weekly plan might look like this. Gentle walking most days, sit-to-stands 3 days per week, balance practice near a counter, and 1 rest day where you still move lightly around the house. At this point, if you are noticing that knee pain often gets worse when you stop moving completely, comment yes. It helps others realize they are not alone, and it is a useful moment to check your own pattern. Now we move to a factor that can make knee pain feel heavier, deeper, and more stubborn. It is not only about the joint. It is about the load the joint carries every single day. 6. Extra body weight changes knee pressure more than people realize what people think it is. Many people think body weight affects the knee only in a simple one-to-one way. They may think gaining 10 pounds means the knee feels 10 pounds more pressure. What it actually is. The knee often experiences several times your body weight during walking, stairs, and rising from a chair. So even a modest change in body weight can make a noticeable difference in knee stress. This is not about blame. It is about physics. What is happening in the body? When you walk, your knee does not just hold your weight like a scale. It manages movement, gravity, impact, and muscle force. Going downstairs or standing from a low chair can multiply the load. Think of your knee like a small elevator cable. If the elevator carries a little more weight every trip, the cable works harder each time. One trip may not matter. Thousands of trips over months and years can matter. Body fat can also influence inflammation. Fat tissue is not just storage. It can release chemical signals that affect inflammation in the body. For some people, this may make painful joints more reactive. Light scientific support. Weight management is commonly recommended for knee osteoarthritis because it can reduce joint load and improve symptoms. Even small, steady weight loss can reduce pressure across the knee during daily movement. Practical habit or fix. Do not start with extreme dieting. Start with one repeatable habit. Add protein at breakfast to support muscle. Reduce sugary drinks if they are part of your routine. Use a smaller plate at dinner. Take a short walk after meals if your knee tolerates it. These are small levers, but small levers used daily can move a heavy door. Also remember that strength and weight work together. Losing weight without maintaining muscle can make weakness worse. The goal is not simply to be lighter. The goal is to become better supported. A practical meal habit is the plate method. Half the plate with vegetables or salad, 1/4 with protein, 1/4 with a high-fiber carbohydrate, like beans, potatoes, oats, or whole grains. This supports energy without making the plan complicated. The next factor is quieter. Many people never connect it to knee pain, but it can influence stiffness, recovery, and how painful the knee feels in the morning. 7. Poor circulation and low-grade inflammation can slow recovery. What people think it is. People often assume knee pain is only mechanical. They think it is only cartilage, bone, or a ligament. What it actually is, knee pain after 65 is often affected by circulation, inflammation, blood sugar control, sleep, and general health. The knee does not live separately from the rest of the body. What is happening in the body? Healing and repair depend on delivery. Blood brings oxygen and nutrients. The lymphatic system clears waste. Movement helps both systems work. Think of circulation like a delivery system in a city. If roads are open and traffic flows, supplies arrive and waste is removed. If traffic slows, everything takes longer. When someone sits most of the day, the calf muscles are quiet. The calf muscles are sometimes called a second heart because they help pump blood back upward. When they do not contract often, the legs can feel heavy, stiff, or swollen. Inflammation is also part of the picture. Some inflammation is normal after stress or injury, but when inflammation stays elevated, tissues may become more sensitive. Conditions like diabetes, poor sleep, high stress, and inactivity can all affect this system. Light scientific support. General health factors can influence pain intensity and recovery. People with chronic inflammation, poor sleep, or metabolic problems often report more pain and slower improvement. This does not mean the knee problem is not real. It means the knee is being affected by the whole body environment. Practical habit or fix, use circulation breaks. Every 30 to 60 minutes, move your ankles up and down 10 times. Stand up if safe. Take a slow lap around the room. Do gentle calf raises while holding a counter. This is not exercise in the usual sense. It is maintenance. Hydration also matters. Dehydration can make tissues feel less resilient and may worsen muscle cramps. You do not need to overdo water, but many older adults drink less than they think. Nutrition can support joint health too. Omega-3 fatty acids, often from fish oil, may support a healthier inflammation response for some people. Vitamin D may support bone and muscle health, especially in people with low levels. These are supports only, not cures. They work best alongside movement, strength, sleep, and medical care. Always consult a doctor before using supplements, especially if you take blood thinners, have kidney disease, have upcoming surgery, or already take several medications. A gentle anti-inflammatory food pattern can also help. This means more fish, beans, olive oil, vegetables, berries, nuts if tolerated, and fewer highly processed foods. It does not need to be perfect. It needs to be consistent. Now we come to a serious but often overlooked issue. It can make knee pain worse because the body starts protecting itself in ways that actually increase risk. 8. Balance loss makes the knee tighten and guard. What people think it is, many people think balance problems are separate from knee pain. They may say, "My balance is not great, but my real problem is my knee." What it actually is, balance and knee pain are closely connected. If the body does not feel safe, it tightens. Muscles around the knee may guard. Steps become shorter. The person may look down more, hold their breath, or stiffen the legs. That protective pattern can increase knee pressure. What is happening in the body? Balance depends on three main systems: vision, inner ear signals, and body position sensors in the feet, ankles, knees, and hips. These sensors tell the brain where the body is in space. Think of these sensors like a home security system. If the signals are clear, the brain feels safe. If the signals become blurry, the brain becomes cautious. After 65, balance can change because of weaker muscles, reduced foot sensation, vision changes, medication side effects, or less practice. If someone has already had a near fall, the nervous system may become even more guarded. A guarded walking pattern is like driving with the parking brake partly on. The body moves, but everything is tense. The knees do not swing freely. The hips do not extend well. The ankles do not roll smoothly. More effort is used for less movement. Light scientific support. Balance training can improve confidence and function in older adults. For people with knee pain, better balance can reduce fear of movement and improve walking mechanics. Practical habit or fix. Practice balance safely. Stand near a counter with both hands lightly touching. Place your feet hip-width apart. Slowly shift your weight from one foot to the other. Keep the movement small. Then try standing with one foot slightly in front of the other, like a narrow stance. Hold for 10 seconds while touching the counter. Do not practice balance in the middle of a room. Do not close your eyes unless a clinician has told you to. Safety comes first. Another helpful habit is to strengthen the feet. While seated, press your toes into the floor and release. Then lift your toes while keeping your heels down. The feet are the foundation. A better foundation helps the knee. The next factor is where knee pain can move from annoying to more concerning. It involves swelling, warmth, and the signs that the joint may be irritated beyond normal stiffness. 9. Swelling changes the way the knee muscle works. What people think it is. Some people think swelling is just extra fluid and not very important unless the knee looks very large. What it actually is. Even mild swelling can change how the knee functions. It can limit motion, increase pressure, and reduce the ability of the thigh muscle to contract properly. What is happening in the body? The knee joint is surrounded by a capsule. When fluid increases inside that capsule, pressure rises. The body responds by protecting the joint. One protective response is to reduce activation of the quadriceps muscle. This is like a circuit breaker in a house. When the system senses a problem, it reduces power to protect itself. But if the thigh muscle does not fire well, the knee becomes less supported. Then the joint may feel weaker, heavier, or more unstable. People often describe this as, "My knee feels full," or, "It feels like it will not bend all the way." Sometimes the swelling is obvious. Other times it is subtle. The knee may simply feel tight behind the kneecap or stiff after sitting. Light scientific support. Joint swelling can inhibit muscle activation around the knee. This is one reason swelling and weakness often appear together. Reducing irritation and restoring gentle motion can help the muscle work better again. Practical habit or fix. Check for swelling patterns. Compare both knees in the evening. Notice if one looks puffier around the kneecap. Notice if the knee feels warmer than the other side. Notice if bending is more limited after activity. For mild swelling after activity, use the calm down approach. Elevate the leg, gently bend and straighten the knee in a comfortable range. Consider a cold pack wrapped in cloth for 10 to 15 minutes and reduce the next day's activity slightly. Do not completely stop moving unless advised by a clinician. Gentle motion helps fluid move. But do not push deep bends, heavy stairs, or long walks during a flare. Seek medical advice promptly if swelling is sudden, severe, very warm, red, associated with fever, follows a fall, or comes with calf pain, chest pain, or shortness of breath. This brings us to the last major factor, and it is one of the most important for long-term knee health. It is about the way small daily choices either protect the knee or slowly irritate it. 10. Daily movement habits can quietly overload the knee. What people think it is. Many people look for one big cause. They search for the one injury, the one wrong step, the one bad movement. What it actually is. Often, knee pain after 65 is shaped by repeated small stresses. The chair that is too low. The stairs taken too quickly. the shoes that are worn down, the habit of twisting while standing, the sudden jump from low activity to a long weekend walk. The knee remembers repetition. What is happening in the body? Tissues adapt to what they experience. If stress is gradual and supported, the body gets stronger. If stress is sudden, uneven, or repeated without recovery, the body becomes irritated. Think of skin on the hand. A little regular use builds a callus. Too much rubbing at once creates a blister. The knee is similar. It can adapt, but it does not like sudden overload. Common daily overloads include standing up from a very low sofa, carrying heavy bags on stairs, kneeling for gardening without padding, sitting for hours and then walking too far, wearing unsupportive slippers all day, and twisting the knee when turning instead of moving the feet. Light scientific support. Joint load is influenced by movement patterns, footwear, strength, and activity volume. Managing load is a key part of reducing knee pain. This does not mean avoiding life. It means adjusting the way the knee receives stress. Practical habit or fix. Use the one change first rule. Raise your chair height with a firm cushion if standing is painful. Turn your whole body instead of twisting on a planted foot. Use supportive shoes inside the house if hard floors bother your knees. Break chores into shorter blocks. Use a handrail on stairs, not because you are weak, but because it spreads the work. For stairs, try this. When going up, lead with the stronger or less painful leg. When going down, lead with the more painful leg while holding the rail. Many physical therapists teach the phrase, up with the good, down with the bad. It is simple, and it can reduce strain during a flare. For getting out of a chair, move to the edge, place feet under the knees, lean slightly forward from the hips, and stand by pushing through the heels. Avoid letting the knees collapse inward. This one movement happens many times a day, so improving it can make a real difference. Now, let's connect everything. Knee pain after 65 is rarely just one thing. It is usually a mix of strength, mobility, balance, circulation, inflammation, joint changes, and daily load. That may sound like a lot, but it is also good news. It means there are several doors into improvement. You do not need to fix everything at once. Start with the first and most important question. Is my knee supported? Support comes from the thigh muscles, the hip muscles, the ankles, the feet, and the way you move through the day. If you only chase pain, you may miss the reason pain keeps returning. But if you improve support, many other things begin to change. Walking feels smoother. Stairs feel less threatening. The knee feels less alone. Let's do a simple recap. First, weak thigh muscles make the knee do too much work. The fix is gentle strength, especially sit-to-stands and controlled leg exercises. Second, stiff hips can twist the knees. The fix is hip mobility and sidestep strength, so the knee tracks better. Third, stiff ankles change how force travels upward. The fix is calf stretching and ankle rocks, so walking becomes smoother. Fourth, cartilage changes are not the same as a hopeless knee. The fix is wise, low-impact movement that keeps the joint nourished. Fifth, too much rest can make the knee more sensitive. The fix is graded activity that starts below your limit. Sixth, extra body weight can multiply knee pressure. The fix is steady, realistic habits that support both weight and muscle. Seventh, circulation and inflammation affect recovery. The fix is movement breaks, sleep, hydration, nutrition, and medical support when needed. Eighth, balance loss makes the knee guard and tighten. The fix is safe balance practice near support. Ninth, swelling can shut down muscle support. The fix is to notice swelling early, calm the joint, and seek care for warning signs. 10th, daily habits can overload the knee quietly. The fix is to change the repeated movements that irritate the joint. The most important idea is this. Your knee is not just a worn part. It is part of a living system. And now you know what many people never get told. Pain in the knee does not always mean the knee itself is the first thing to fix. Often, the first thing to fix is the support system around it. Your action step today is simple. For the next 24 hours, observe 3 things: how you stand up from a chair, how your knees feel on stairs, and whether your knee feels better or worse after short, gentle movement. Do not judge it, just observe it. Then choose one small fix: 5 sit-to-stands, 1 short walk, a calf stretch, or a balance drill at the counter. Small changes done consistently are like placing supports under that bridge. One support may seem small, but over time, the whole structure becomes more stable. If your knee pain is severe, sudden, swollen, red, hot, caused by a fall, or stopping you from bearing weight, please speak with a healthcare professional. And if you have medical conditions or take medications, get personal advice before changing exercise or using supplements. Now you know what to look for. You know that pain is information, not a life sentence. You know that after 65, the goal is not to avoid movement. The goal is to restore the right kind of movement. Subscribe for more calm, practical guidance on staying strong and mobile as you age. Comment with the one knee habit you are going to check today. And share this with someone who has been told their knees hurt only because they are getting older.